Hi everybody, today I'm going to discuss with you Patellofemoral pain syndrome, or PFPS for short. So what is PFPS? Well, it's generally described as a non-trauma associated pathology, so in the absence of trauma. We also know that it is characterised as pain at the front of the knee, but just behind the kneecap. So if a patient was to come into here with PFPS, I would expect it to be them say it's kind of at the front of the knee. They can't quite ascertain with one specific finger, but they can say that it's at the front of the knee, but behind the kneecap. Okay. We know that it's one of the most common causes of knee pain, and it's generally thought to be a precursor to osteoarthritis. That's what we know from reading the literature. So what are the causes of PFPS? Well, we know that there's a higher incidence in females than in males, and we know that it's multifactorial. So some of the causes include a tilt or maltracking of the patella within the trochlear groove on the distal femur. So what that means in lay terms is the kneecap that you can see here that sits within the trochlear groove in there, and as a person flexes and extends or bends and straightens their knee, like so, the patella should glide nice and smoothly up and down within that trochlear groove. However, sometimes, for a number of reasons, the patella can have a slight tilt. That's exaggerated, but a slight tilt, or it can veer off to one side, and therefore as the patient flexes and extends their patellofemoral joint, their knee, there is a maltracking, kind of a veering off to one side. There can also be issues in the hip itself with hip mechanics, and distally, so in the foot and ankles. So for example, overpronation or a flat foot can contribute to issues higher up, i.e. PFPS. There can also be an issue with internal rotation of the tibia on the femur, this thigh bone here. So internal rotation would be like so, like a little twist on the joint. And all these causes, as you can see, are caused by an imbalance somewhere. So an imbalance in the quadriceps, an imbalance more distally, in the foot. All of them control the patellar movement during knee flexion and extension. What are the symptoms of PFPS? Well, as I've mentioned, if a patient was to come into clinic here with what I think is PFPS, I would expect them to say they have pain at the front of the knee, just behind the kneecap, and it's a bother for them when they are exerting themselves during activity or after activity. So for example, ascending or descending the stairs, walking, running, similarly cycling, anything where they are loading that knee, for example during jumping, where they are loading that knee during a flexed or extended state, I would expect them to say that they have symptoms. Not in all of those activities, but whatever their chosen activity is, or it could be something as simple as I've said as going up and down the stairs that can contribute to their symptoms. How is PFPS diagnosed? A thorough case history is required. So again, expecting the patient to say that they have pain at the front of the knee, that it comes on with either during or after performance, and clinical testing is also something that we would do. So getting the patient to reproduce their pain would tell me yay or nay to whether that patient has PFPS. So for example, getting them to perform a squat test can be very simple, just getting them to dip down into a squat, or getting them to reproduce their chosen activity. So their activity that they perform at home or outdoors, wherever, external to physio, whereby their symptoms come on. So for example, if they're at home and they ascend the stairs, and after the 3rd step, 4th step, 5th step, they know that their symptoms will come on, then I can take them to the stairs here and I can get the patient to reproduce their symptoms. In addition to a thorough subjective history and a case history, and a physical examination, what we would also potentially do, and this is not in every single case, because usually a thorough subjective history and a physical examination are enough to determine whether the patient has PFPS. However, sometimes we might send them for an MRI scan or a CT scan just to rule in or out other pathologies. So what is the treatment for PFPS? Well, physiotherapy is known to be a modality that is excellent at treating or providing rehabilitation for patients with PFPS. The aims of rehab or physiotherapy would be to improve their pain and to improve their function. So over the course of the rehab process, I would expect soon into the process that the patient would say, my symptoms are coming down. So for example, if their symptoms were coming on as early as ascending or descending the 3rd step in a series of 15 steps, and then a week or 2 down the line they can tell me that they are now able to go to the 10th step out of 15 before their symptoms come on, then that's a slight improvement there, and we would expect those baby steps to continuously be made throughout the process. Rehab should also be, it's important to say, rehab should also be focused around multi-joints rather than the single joint. In other words, rehabilitation should not just hone in on the knee itself, but it should look at the hip higher up and the foot and ankle further down, more distally. Because if we just hone in on one joint and neglect the rest, the other areas above and below, then the rehab process will come to a standstill at some point, because we haven't necessarily addressed the whole picture. And as I've said earlier, some of the causes of PFPS can be an issue with the hip contributing lower down into the knee. And even though the patient is getting their symptoms in the knee, the issue is actually stemming from up top or more distally in the foot and ankle. So it's very important that we as physios address the whole picture. So I hope that has helped you understand what PFPS is. As I've said, it's a very common knee complaint. So if you have liked this video or any of my previous videos, don't forget to subscribe on the subscribe button down below, and we will be sure to send you some more videos on other pathologies. Thanks very much.